So the idea now is to talk about the acoustic reflex decay when it is positive and when it is negative. The idea of the acoustic reflex decay or the significant is that it can help direct the pathologies in the eighth cranial nerve, especially when looking for the acoustic schwannoma uh, as a pathology of the eighth cranial nerve. Now, the acoustic reflex decay is positive when the decay of the reflex, you can see here that the compliance is reduced when the acoustic reflex is stimulated. The stimulus is here, and it reduces the compliance, and this is okay. This is what should happen in a normal patient. This is because when the acoustic reflex works, the stapedius is uh, tighter to the oval window and rotate less. Therefore, the compliance of the tympanic membrane is reduced. So this is normal, that there is a reduction in the compliance, that what should happen with the acoustic reflex. But when we are talking about a decay, we are talking about that the response of the acoustic reflex reduce with time more than 50% than it started in 10 seconds. So we present the stimulus 1 decibels above the acoustic reflex threshold for as long as 10 seconds. In this 10 seconds, we are looking at the response. If the response stays or reduced but not significantly, namely less than 50% in 10 seconds, the response of the acoustic reflex, so we say that it's a negative acoustic reflex decay. But if it reduced more than 50%, in 10 seconds, we say that the acoustic reflex decay is positive, and it can direct us to pathologies of the eighth cranial nerve, retrocochlear pathologies. For example, acoustic neurinoma. Also, neuropathies, but acoustic neurinoma is maybe the most important and significant one. Okay, so this is the idea of acoustic reflex decay, and it's quite sensitive, but it has a lower specificity. This is what I wanted to talk about in the acoustic reflex decay. As you can see here, maybe this is important. This is interesting to see this image. You can see here again the response, the acoustic reflex. This is negative reflex decay because you see the stimulus, and then the stimulus tone is here, and you can see the stimulus continues and the decay and the acoustic reflex works. This one, the acoustic reflex, start to decay, but it less than 50% in 10 seconds, so it's also negative. But this one is more than decay of 50% in 10 seconds, so this is a positive reflex decay. Okay, this was about the acoustic reflex decay and its importance. There are also nuances like you shouldn't check it in ipsilateral, or you it prefer to check it contralateral, some says, but I wanted to talk about the idea, not the nuances. So this is the idea. Thank you very much. If there are any mistakes or corrections or additions, please tell me. And that's it.